Hi, everyone. This is Dr. Isabelle Amigues, your friendly rheumatologist. And I'm the host of Rheumatology 101, where we learn things about rheumatology. And you're going to tell me today, wait, the title is The Power of Mindset. And yes, it is. So we're going to take a little bit of a break when it comes to the science because the power of mindset is actually incredibly powerful, incredibly important in getting to remission. I'm going to get the idea of remission, but it can be cured. I offer remission to patients with a rheumatologic disorder. I can't easily say cured. The difference between being cured and being in remission is that cured, it's gone. Remission might still be there, but you have no symptom whatsoever. As I often say, if you're thinking of cold sore, if you're thinking of EBV, TMV, a lot of different viral infection, you actually still have them, but you're in remission from them. Okay, so being in remission versus cure is not much. It's okay. It's totally fine. And I think I'm gonna give some example so that I explain why this is such an important topic for me. So I want to say about 10 years ago, I started realizing the power of mindset. So, what is the difference between, like, I was wondering at one point what the difference of me as a rheumatologist was with other rheumatologists. And I had this conversation with a colleague of mine who's very, very well versed in energy healing and so on. And she said something that I think about all of the time, which is I am the diamond, I am the gift. My patients use me as their healer, right? And yes, it comes with offering medications and so on, but really the healing is coming from my gift, which is this crystal or diamond that I'm offering to my patients. And I had a patient, actually, it's happened several times, but I'm going to give you an example. So I had a patient who had been like, who came to see me after she had seen many other rheumatologists. So this is about 10 years ago. And we all have this in medicine where you have a patient that comes in, they have seen multiple other doctors, and so you're one more of the people that they've seen, and it might be because they have a flare, but they really haven't had a good life for the whole time that this has happened, right? So this patient comes in and she's seen multiple rheumatologists before, and she's seen multiple other doctors, and she's at her wits end, and thinking, well, whatever, I'm gonna try another rheumatologist. We never know, right? And she clearly has an inflammatory arthritis, and clearly there is something going on. And so I make a diagnosis of rheumatoid arthritis. I confirm, some what the thoughts were from previous rheumatologists, and we say, okay, well, this is rheumatoid arthritis. This is what you can expect in terms of treatment. So, right, like this is like a fire. We're trying to take care of the fire, and we want to be aggressive at first. And we start a treatment, and she is not able to tolerate it, right? So she develops an allergic reaction. So then we try another treatment, and same thing. She's not able to tolerate it. She starts having nausea, vomiting. Try another treatment, and at one point, I'm thinking, this is going nowhere. Like literally, this is going nowhere, and I don't really know why. And I did what I now do on a regular basis, which is basically I stopped and I said, look, can you think that maybe there is a reason why you are letting this rheumatoid arthritis rule your life? Is there anything that is positive from this condition? Is there anything that's positive from this condition? And so she looks at me, right? Like, what? Like, there's nothing positive. This is why I'm coming here. And what are you talking about, right? But she comes back and like later on, and I had started a new treatment. And right, like there's no reason why that new treatment was better tolerated than the others. But what happened is she starts telling me, look, I actually wrote something about what the rheumatoid arthritis has brought to me. And there is many things that this rheumatoid arthritis has brought to me. And so then she basically explains that she had this, coming to grace moment where she realized that this was not all bad and that she was clinging on the positive that the rheumatoid arthritis had brought to her. And she didn't want to let that go. And that is one reason why she couldn't, she didn't feel that she was deserving of being in remission. So then she gets the I think it may have been my fourth treatment that I offered her, right? And she has been in remission since, right? What's really interesting to me is that this is just one example. I've had many. If you've listened to the TEDx talk, there's this patient that was in his 30s that had seen 10 of a rheumatologist, and same exact story, just wouldn't actually take the medicine at all, wouldn't take it at all. And why? And just realizing that his inflammatory arthritis had brought something to him. So, right, like when you think about it, it's this mindset shift that allows those patients to say, I am deserving of remission. And if I am deserving of remission, I'm going to be fully present in my healing. And I'm not going to refuse the treatment. I'm not going to, and when I say refuse, you have to realize, right? Like you can refuse Plan B by saying, no, I don't want this treatment. That's not how our patients usually do that. They usually say, no problem, I'll try it. And then they may look at the drugs and not go to the appointments to get an infusion, for example. They may not get the injection on themselves, or they may not take the pill, or they may forget. Or they may develop an allergic reaction. It doesn't have to be allergic. It can just be a reaction to it. And all of those are basically your body saying, your mind saying, I don't want this. But really, what are you telling yourself? You're telling yourself, I do not deserve this. And you do. And everyone deserves to be healthy. Every single one of us. You may learn a lesson when you have a disease. You may learn a lesson when you have a condition, right? This, something that's wrong, like not doing well. This is, and then conditioned with, something that you're living with, condition. And so I think, to me, like what when I approach patients, I always think that a disease is just a way of your body, and it, like when I say body, it also may be the mind, of communicating with you. And if your body has been whispering for many years and you have not listened to them, it's going to have to shout. And sometimes it might be an inflammatory arthritis, severely inflammatory arthritis. Sometimes it's going to be pain. Some other time it's going to be fatigue. And at that moment, you will have to listen. And when you listen, my recommendations, right, is to say, listen. Don't go into this position of like, oh, I hate this. My body is not, I don't have agency on my body. Your body is a universe of your cells, right? Like it's a universe, and everyone is living in harmony. That's the goal, is to live in harmony. And if somehow there is something in your life that you're not at peace with, there is a chance that your body would react and do this. I mean, dermatologists will tell you that, like you will develop a rash, a skin rash, usually if you're stressed. I mean, we see kids, right? Like parents divorce, they'll develop atopic dermatitis, which is eczema. And that's fascinating to me, because I mean, yes, of course your body is going to react. That's normal. That actually not reacting would be the abnormal piece, right? If you have something that's happening to you, you're going to react. You're going to have a heart rate that's going to increase. You're going to have a breath that's more shallow. And so listen. And once you listen, I I recommend that you imagine what health looks like. And this mindset is very important, right? Like, so if we go back to the topic, which is a mindset, mindset is what? Is basically saying, I deserve, I am healthy. And even when the worst is happening, you can actually see what's right. So what I want to take my example actually, right? I don't like to say my, but because I don't like to put it in my universe. But when I had to deal with a, not mine, a cancer, right? I remember doing meditation, visualization, affirmation. And I would say, I feel vibrantly healthy and alive. And the more scared I was of stage 4, right, cancer, the more I would say this: I am healthy and alive. I am healthy and alive. I am healthy and alive. Because the truth is that I was healthy and I was alive. I am currently healthy and I am currently alive. It doesn't matter what a diagnosis is telling you, because it's just data. You can be healthy and alive with a diagnosis. Who cares? We don't care. Like, it's important for the doctor to treat you. You are still healthy and alive. And so when you're saying this to yourself, you're also making it happen. So what that means is you're going to start having no issues with medication. So like, people will tell you, when I went for chemo, that it didn't show that I looked healthier than ever. Why? Because I was also taking care of myself. I was meditating, I was visualizing, I was doing energy healing, I was taking my medicine, and I was telling my body it's going to be fine. It is fine. And so that's the shift that I want everyone to do, which is realize that mindset can happen before the healing. And I almost want to say that you need the mind, like, you don't need the mindset to heal. I can heal you with steroids, right? I can make your pain go away with steroid if you have rheumatoid arthritis and so on. The issue is that I'm not helping you heal in the long term, and I might give you complications from the steroids, right? And so then the idea is to pause and to think, what am I learning from this? You're not asking yourself, why is this happening to me? That's the wrong question. But rather, what am I learning from this? What I can tell you is that this question, when you answer it, you're letting go of the need to hold on to that condition, right? Ask yourself this question and ask it every day. Ask yourself that question every day. Don't feel you're sorry for yourself. I mean, you can feel sorry for yourself, feel the emotion, and then let it go. And then be like, okay, fine, this is what I'm dealing with, but that's okay. I still am healthy and alive. I am healthy and alive. Okay. So I want to wrap this up, which is, I have an experience of being a rheumatologist for over 20 years. And that's all I've done since I'm 5 years old. No, I'm just kidding. But it has been 20 years. And what I have learned is that it's not a fight. It's not a fight against your body, definitely not. It is not even a fight against the disease, definitely not as well. It is a journey of learning, and it is a journey of education and educating yourself of what is it that this is bringing to you. Like, there is always something positive. Always. Like, even if your doctor were to tell you you're dying tomorrow, which they should never say that, because we don't know what's in there in store for our patients. We never know. And I can tell you this: 20 years of experience, more than 20 years in medicine in general, but like, we don't know. We never know. And but even in an hypothetical care, right? Like, someone that allows you to say goodbye, that allows you to live your life with intention. And so, to me, that's what that brought me. Is like, I live my life with intention, and I consider my life a gift to myself first, a gift to my family second, a gift to my patient and friends third, right? And it's this intention, it's realizing that thanks to this this health scare, I have a better and a bigger gift. And that is the mindset that I'm talking about, which is to see the beauty of every single moment and to realize also that you don't have to be alone in this journey. That's the beauty of a condition, right? Like, and in rheumatology particularly, we can get you to remission. We definitely can get you to remission. And I want to give that hope, which is trust that our bodies are incredibly powerful. There is no one that can tell you in the future where you're going, except if they're telling you that you're going to be fine. That's great. We want that, and you are all going to be fine. You're all fine. You are all healthy and alive. I am healthy and alive, right? And this journey is a gift, no matter where you are at whatever moment, and you do not have to do it alone because you have healers, you have health coaches, you have doctors, and it's a very special moment that we're seeing right now because doctors are finally saying no to insurances because they're like, this is not how I want to practice medicine. I'm done. And I'm seeing more and more doctors do what I do, which is saying, I'm working directly with my patients. And yes, we'll use the insurance for medicine, labs, and so on, and tests, but I'm working directly with my patients. And where our goal is to offer us being the jewel that we want to offer our patients. We are the jewel that we are offering our patients. And you can have us next to you, the crystal next to you. Okay, so if you do only one thing today is repeating, I am healthy and alive, I am healthy and alive. And if you have another type of intention, share it, do that. And I think this has changed my life as a person, so as a patient, and also as a physician, because I think that our role as physician is not to say what to do. But what we are doing is that we're sharing our knowledge so that our patients can decide what's the best for them. And our goal is to show what's possible. So in rheumatoid arthritis, the possible is full remission, no more symptoms. And in a lot of the rheumatology conditions, that's where we can go. Okay. So anyway, it's been a pleasure. If you have enjoyed this episode, please share it, subscribe on the YouTube channel. I'm now trying to stream on LinkedIn, Twitter, Instagram, Facebook, all of the social media, just so that, because everyone has a preferred one. And I would love for you, if you can, subscribe under the YouTube channel, Rheumatology 101. I would love that. And you can also share this episode. And I'm just going to say hi. I'm Amélie. Such a pleasure to see you. Bonjour, ça va? And then Kip. And then I agree 100%. Then think a positive mindset. Positive mindset is a much wider benefit than immune disease. I am 73 and I have older friends who lead very active lives because they don't let age define them. Amen to that. Do not let anything than you define you. And also, I don't know if it's because I'm getting older, but I really don't think so. I think I'm actually really objectively seeing this. The way that we age is very different than before. So a 73-year-old person right now is actually young versus before, when 73 was getting being older. And I saw someone that's 89 continue to rock climb, ski, and mountain bike. And mountain bikes more than I currently do. So it's a number. It's just a number. And our lives are gifts. So let's use them. All right. I'm going to go. It's been more than the 15 minutes that I tried to stop myself at. It's a pleasure. I'm seeing that, there's quite a bit of you that are that are watching this currently. I don't see your comments, but I'm saying hi. If you're watching this on replay, put #replay. If you're watching this live, put #live. And it's a pleasure, as always. Take good care, everyone. And I'll see you next week. Bye-bye.